All right, it is about 3 after, so we can get started and get through the introductions as other folks log on. For folks that don't know me, my name is Nicole Jorwick. I'm the Senior Director of Public Policy for the ARC, among other titles. I'll turn it over to Bethany and Claire to introduce themselves.
Hi, everybody. This is Bethany Lilly. I am the Director of Income Policy with the ARC, which means I handle Social Security, SSI, and other programs like that. Claire?
Hi, everyone. Good afternoon, or like Nicole said, good morning, depending on where you are in the country. I'm the Senior Director of Advocacy and Mobilization, and I lead our grassroots advocacy efforts.
Thank you, Bethany and Claire. And we're glad to be joining you all today for a webinar on the fact that congressional recess is over and now what? We know we have been asking everyone to be doing a lot of grassroots activity all year, but particularly during the recess to really continue the push on our priority issues. I'm going to start us off by talking about the priority issues that I cover, first being home and community-based services. Obviously, we did get the $12.7 billion in funding that was included in the American Rescue Plan Act, or ARPA. That was a total of $12.7 billion to equate to 1 year of funding to support strengthening and expanding access to home and community-based services. Up until this point, there has not been an ARPA spending plan that has been approved. So states that want to take up that the FMAP from ARPA have to submit a plan. And so far, not one of them has been approved, although guidance has been out. And we know a lot of our state chapters and local chapters are working with their state administrators to make sure that that funding is well spent. But we very much know and knew that funding was funding that should have been passed in March of 2020, and we needed to focus on getting funding for moving forward. We don't want to just get back to status quo. We want to make sure that we're building a Medicaid home and community-based service system that can serve everyone who needs the support. It's going to be something that we're going to continue to work on even past this, but right now what our focus is on is for the Better Care, Better Jobs Act. The Better Care, Better Jobs Act came out in June. The bill is really meant to operationalize the proposals that were in President Biden's Build Back Better plan. And that included a $400 billion investment to both increase access to home and community-based services and also to address the longstanding workforce crisis that has been part of the disability service system. It is currently included in the big budget reconciliation package that is moving through Congress. However, it is not included at the number that we need it to. As of right now, and as we speak, the Committee of Jurisdiction, so I've talked about this before, but for Medicaid, the Committee of Jurisdiction in the House, which is where the reconciliation package is currently being negotiated, is in the Energy and Commerce Committee. We did see earlier this week or late last week, time is a real weird vortex at the moment, but that bill does include 190 billion. That's not enough. It is up from what we had been hearing rumors of 150 billion, but we know because of the size of the problems, in order to address both access to services and workforce, we need to get that number up to at least $250 billion. So that has been the focus. Right now, as I mentioned, Energy and Commerce is marking up the bill. We don't expect that there's going to be any additional funding that will end up in the bill during that markup, but there are several steps even before it goes to the Senate where we have hopes of getting the number up. After the bill passes Energy and Commerce, which we hope that it will go to the Budget Committee. The Budget Committee is the committee that's in charge of putting all the different pieces together, and pieces that Bethany are going to talk about, and making sure that it all fits under the budget resolution, which is what passed before recess started. The budget resolution is the framework that Congress passed for what this bill is going to look like. We are hoping and we are pushing very hard with the committee level staff on that committee to make sure that if there's funding that falls away from one place, that it can go into home and community-based services. The committees, I'm getting a little wonky, but I just think it's important to understand because we know that our the ARC of New Jersey, who Representative Pallone is their representative, one of the representatives, and he chairs the committee. We know that folks have been working and pushing really hard. And so I do want to make sure that there's an understanding that we know that the Energy and Commerce Committee did as much as they could, but they were a little bit constrained because there's one number in the Senate side on Senate Finance, but Senate Finance has such a big portfolio that it gets broken up between committees in the House. And so they had their hands were a bit tied between the committee jurisdictional issues as well as the competing priorities that are also in their jurisdiction, including things like vision and dental for Medicare, things that we don't oppose, but things that ultimately end up competing for dollars. So I'm probably telling you a little bit more detail than you need, but I just want to make sure that everyone understands the complex process that's currently going on. So we will hope that during when the budget committee looks at the bill before it goes to the rules committee, before it goes for full passage, which we do expect to vote for full passage in late September, that that number will go up from 190 billion because we really need it to. Funding itself, the way that it's written, it is at this point a 7% federal matching assistance percentage bump, but we are really working and pushing to make sure that that matches the ARPA at least at the 10%. Ultimately, the funding, and this is would facilitate statewide planning to develop an HCBS infrastructure improvement plan. We know that states are some states are further along than others, but we know that states are going to need time, just like with the American Rescue Plan Act, and that was only 1 year of funding. This year, we're talking about 10 years of funding. So we want to make sure that states have time to actually develop a plan that can mean that they can both expand access to services and address workforce issues. The funding is an enhancement, a permanent increase in that Medicaid match. So right now it's at 7%. We'll hope to get it up to 10%, but the bill makes that a permanent increase to make sure that home and community-based services that have always not gotten as much support as other funding streams has that bump permanently to continue to incentivize states to expand those services. There's a separate FMAP bump of 2% to incentivize workforce growth, and that includes increasing wages, but also it talks about training. And there's several components around quality and accountability, wanting to make sure that states are collecting viable data that can support future innovations in the program. Another piece that I keep kind of forgetting about, which is a really important component that we started, I've been with the ARC for 6 years, and I think I started lobbying right around when I started, is that this bill would also permanently authorize the Money Follows the Person program. That program provides 100% federal match for states for the first year for moving people out of people who choose it out of large congregate settings like nursing homes and back into their communities. So that's a really big and important win, but because we're talking about a much bigger pot of money, it sometimes gets lost, but I really wanted to make sure to raise that here. So at the moment, when it comes to HCBS, we need to push. Claire's going to talk a little bit later about how you can do that, and she's been doing a fantastic job of making sure that everyone has the materials that they need. We just had a day of action around home and community-based services yesterday, and we know that that was really impactful on the Hill, and Claire will talk numbers and all that, but it's just really important. We know that we've been talking about HCBS since the beginning of the pandemic, and we're going to probably keep talking about it even after the reconciliation bill is passed, but that's because a program that was created 40 years ago has never been properly funded. And so it's really important, and we're really thankful for everyone who's been sharing their stories and that sort of thing, and that's going to help us get over the finish line. HCBS is one of our top priorities, both access to services and workforce, but we have a lot of other priorities, and the policy team, not just Bethany and I, the full team, are working on a lot of different issues, but I'm going to turn it over to Bethany to fill us in on the updates in her issue areas.
Thanks, Nicole. So I think Nicole did one of the best jobs that I've heard in a while, summarizing exactly how incredibly hectic Congress is right now. Right now, today, we have the Ways and Means Committee doing things. We have the Energy and Commerce Committee doing things. In fact, a vote failed just as Nicole is speaking now. And so it is really, Congress is very active and very all over the place to some degree. And so, as Nicole said, we're putting out fires where we can with our education staffer, Robin, looking at the funding for IDEA, and us, Mike, keeping track of kind of what else is going on in terms of appropriations. So I'm very glad that we have our team, and I'm very glad that we are talking about this. So within my portfolio, the other big thing that I'm focusing on is related to the Supplemental Security Income Program, or SSI. If you have been on a webinar with me lately, you have heard me explain that as much as I would like to, we cannot make changes to Title II programs, which are the broader Social Security programs. So that could be both Social Security disability insurance and disabled adult child benefits or child disability beneficiaries. Those programs are protected by the filibuster, which can be really helpful for us, but that also means that we can't change them without getting to 60 votes in the Senate. And so we're focusing on SSI right now because we can actually change it through the budget reconciliation process that we're using right now. I have gotten quite a few questions from folks over the past few months about why we're not also looking at SGA or looking at other things. We are looking at those things, but we need 60 votes for them. And right now we have a shot at getting some SSI changes with only 50 votes. So where are we on that? Nicole highlighted, I think, really well that we have hit kind of the rubber meeting the road when it comes to how we're going to be spending money. And there is not a lot of money left. And that is where the SSI changes and what exactly we're arguing for right now becomes really important. There is not going to be enough money for the entire SSI Restoration Act, unfortunately. That is just not something that is realistic right now. You can still highlight the SSI Restoration Act. We still support that act. We still support all of the changes that it would make, but there is not enough money in Congress right now to do that. And so, as much as I love the SSI Restoration Act, we are focused on a couple of things that are part of that bill. And that is because they don't cost as much money. The cheapest thing in the entire SSI Restoration Act is the asset limit increase. That proposal would increase asset limits from the $2,000 that they currently are all the way up to $10,000, which would address a lot of the problems that I know folks have run into this year in terms of stimulus checks and also in terms of not being able to get out and spend as much money as they usually can because of the pandemic. So that would be a huge win, and I would consider that a huge win. And if you have stories about running into problems with the asset limits, I would strongly recommend reaching out to your members of Congress and telling those stories and asking them to increase asset limits. If they happen to find extra money, there are also other changes that would be a possibility. There are rules about how family members can help out with food and with rent that are called the in-kind maintenance and support rules. If you've run into these before, you know how frustrating and annoying they are. SSA also hates administering them. And so we would like to push a little bit on that. And that's something I've brought up a couple of times when members of Congress have asked if we had a little bit more money, what would we like them to do? Another option would be the income disregards, which are rules about how much money, if you get a job and you start making money from that job, how much of that you can keep, and how much you can keep if you're also getting SSDI benefits or other types of benefits in addition to your SSI benefits. Those changes would also be great, and I think would help get more cash into people's pockets. But those do also cost more than the ISM rules, change, elimination, or the asset limits. So those are kind of the three pieces of the SSI Restoration Act that we've been pitching. I think the asset limits is the most likely thing. And so as folks have been asking me, that is what I have been recommending that folks bring up on Capitol Hill if they're talking to member offices or they're talking to other folks. If you get a member who is familiar with SSI and who really understands SSI and how important it is, bringing up one of the other things definitely also makes sense. So that is kind of the big picture of where we are on SSI. I do want to touch on something because I think there have been a lot of questions about this that have come up over the past few days about how does this impact our HCBS advocacy? And I just want to be really clear. Nicole talked about kind of big pots of money. SSI is in a completely different committee than the HCBS money is in. And as I said, we're only asking, if we're asking for asset limits, for about $8 billion. So that's really not much money at all. And it isn't really in competition with the same kind of money that is out there for all of the healthcare provisions, because SSI is a completely different part of the federal government, more or less. So I wouldn't worry about the two being in competition. That's why we feel comfortable advocating for those. But what the SSI money is in competition with is the paid leave money. And if Nicole, you could move to the next slide. I will talk a little bit about paid leave. So one of the things that is also included in the giant, huge budget reconciliation package that we're all very supportive of is a national paid leave program. If you are a family member and you have been trying to access leave during the pandemic, I think you know how hard it is. I know that we have gotten complaints over the years about how impossible it is for siblings and grandparents to take leave when their relative with a disability needs them to help out with something. And that is something that I have been very focused on making sure that this paid leave program includes. And I have good news for you. It does in fact include siblings, it includes grandparents. It has a very generous definition of kind of which family members can take leave to provide care. Where I'm not sure where this is going to come out is in terms of the same number of weeks being available for caregiving and medical leave as are for parental leave. And we're going to have to see on that. That's something I'm tracking very closely, and I'm optimistic we're going to be able to get to the same level. One other thing that we're tracking is related to how this is going to phase in. And that is, as Nicole said, we have all of these budgetary constraints. And so it is very possible that if we pass a paid leave program, it may not kick in for a couple of years. That's not the end of the world. That means we have the program, we can improve on the program. But because of the limited amount of money that Congress is working with right now, they might not have enough money to start the benefits right away. So those are the big picture issues with regards to paid leave. Thank you to everyone who's been talking. I'd like to give a special shout out to the ARC of Arizona and to Kathleen Maldon, who's a member of the ARC of Arizona, who testified at a paid leave briefing yesterday. And she is amazing. And I'm very grateful that she is willing to share her story with members of Congress. And so we will see where this ends up. But as I said, SSI money and paid leave money are kind of coming out of the same pot. We also expect to see unemployment money coming out of that same pot. And so we're keeping an eye on all three of those things and how that will all play out over time. Obviously, folks need improvements to SSI, family members need paid leave, people with disabilities themselves need paid leave if they need to take time off to go to a surgery or have some type of other health crisis. And so these are all really important priorities. And so hopefully we can see a lot of them included in the final package. So let me at this point turn it over to Claire.
Thank you so much, Bethany. Speaking of time off, I was just off for a couple of months, but I'm back now and excited to be with all of you again. Thank you so much to Nicole and Bethany for that great outline. As Bethany said, there is a lot going on right now. It is really complex. And what I'm going to do for the next couple of minutes is outline the top advocacy asks. What are the things that we're actually asking people to do in support of the policy issues that Bethany and Nicole just addressed? And then I'm going to do a quick recap of the tools and resources that are available to chapters to support your advocacy work. So first up, next slide, please, Nicole. Number one ask is stories, stories, stories. We know that stories connecting to a policy issue are absolutely one of the most, if not the most, important and powerful advocacy tools that we have. We want to send thousands of stories to members of Congress to make sure that they understand the importance of home and community-based services, why they matter, what it looks like when people have access to HCBS, what it looks like when people don't have access, what it's like to be on a waiting list. They're being sent as they come in one by one to members of Congress, but we also are planning, when we get kind of a core number, to do an event where we can drop them all off publicly. So please be sharing out the story link. You can see it in the bottom of the slide here. It's also available at the arc.org/action. This is, sometimes you'll hear me refer to it as like kind of like the Mad Libs style action alert, where we ask people a series of questions and it helps them kind of develop their own story and inputs it into a nice message that people can edit and send at the end. So please continue to be sharing this out through your networks, on social media, through email, talk about it in meetings that you have, so we can push it really far and wide and have a huge impact. Slide, please. And the second ask in this order is calls, emails, and tweets to members of Congress. We have a link to our action alert, which is also available at the arc.org/action. You can see here, I took a little screenshot of our action center. This is always where our most up-to-date action alerts are. So if you're ever like, what is the ARC pushing right now? You can go here and see it all right there. You can see I did a little arrow. On the right-hand side is the link to our stories alert. And on the left hand is the call, email, and tweet alert, which also talks about the other issues that Bethany mentioned. So it includes HCBS, SSI improvements, and paid leave. One of the things that we've been doing is following up with people after they share their story and kind of do that number one action and say, hey, thank you so much for sharing your story, for doing that action. The next thing that we're asking folks to do is to make a phone call. So sharing that action alert and really trying to move people up through, what we call the ladder of engagement and take even more actions. I'm happy to share, I know that many chapters were engaged in yesterday's day of action around HCBS. And through our advocacy system, the reason that we send out all these links is because we are able to actually track it in our system and know how many people just took action, how many calls were made, how many emails, and to which members of Congress. So I can tell you that yesterday, through our system, we sent over 3,000 calls, emails, tweets, or stories to members of Congress. So that is a really great Tuesday. Thank you all for all of that work, and we just need to continue to push. I'm going to turn now and talk, next slide please, about some of the resources that we have available. Yes, 3,000 calls. Thank you, Sally. Sally's in the chat. So we have, possibly you've already seen it, it's been out for a little while now. We have a new webpage called the arc.org/COVID-19 recovery. And it outlines all of the top issues that we are advocating for right now: HCBS, paid leave, improvements to SSI, and it has a lot of different things on it. It has plain language fact sheets around workforce, waiting lists, paid leave, SSI, and I'm happy to report that Spanish language versions of these fact sheets are going to be available probably in the next week or two, so stay tuned for that. The page also has a link to all of our action alerts, and it also has a link to all of the state-specific fact sheets that Nicole made available just a few weeks ago. So it's kind of one-stop shopping. Hopefully everything you need for this campaign almost is right there. You can share out with your partners, you can share out with your networks, and we're hoping that it's a very helpful resource for you. Next slide, please. Okay, we also have the Dropbox available that has sample social media, sample letters to the editor, and social media graphics, and we have some updates. All of the material that's currently in there is still relevant, is still appropriate to use, but we're also doing some refreshing and updates. So we have some new paid leave graphics that just went in earlier this week. We're going to be refreshing the letters to the editor, and we are also going to be adding some new sample social media. So be on the lookout for that over the next week or so. There's going to be some new and refreshed materials in the Dropbox link. On the video side, I just want to remind you all of the different videos that we have related to all of these issues. Some are new, some we've made in years past, but we have videos on SSI, on paid leave, on HCBS. I linked to some of them in the spreadsheet, but if you're, I'm sorry, in the PowerPoint, but if you're ever looking for a specific video that you want to share on social or share with a member of Congress or at an event, whatever it might be, and you can't find something, feel free to reach out to me and I will help you track it down. We have all of them on the ARC's YouTube page, but again, if you're ever looking for a specific topic that you can't find, let me know. I also want to remind everyone about the HCBS 101 video that we made. It's the animated video. We made it in the beginning of 2021. That is a great resource because HCBS is complicated. Not everybody understands it. And it's a really great 101 about the program and the issues with funding it historically. We're also working on a new personal story video featuring a storyteller talking about the importance of HCBS in her life that's going to be out in the next couple of weeks. The last thing that I want to mention here is social media is a really critical way to get the word out, for all of us to connect together, for members of Congress to see what we're doing, for other partners to see what we're doing. So I want to remind you of two important hashtags that we're using for this campaign. The first is our We Act Wednesday campaign. I think anyone who's ever heard me talk since 2017 has heard me talk about We Act Wednesday. Since 2017, the ARC of the United States has had this We Act Wednesday campaign where every Wednesday we feature a new way to take action. So it's really important content. It's also good for chapters. You know, if you're running your chapter social media program, you know that every Wednesday you're going to have something that you can repurpose, that you can share. Of course, this is a really critical part of our advocacy work that we're doing right now, but we are posting all week long, not just on Wednesdays. And then the last thing I want to mention here is the Care Can't Wait campaign. I'm sorry, the Care Can't Wait hashtag. This is what we're using and what coalition partners are using to advocate for all of these critical issues. So please, when you are posting on social media, be using this so other people can see what you're doing and we can track what's going on that way. Slide, please. So I mentioned that I was off. This is what I was doing when I was off for a couple of months. If you can't see the slide, I had a baby. And I wanted to use this as an example. I know everyone did such amazing and critical advocacy work in August and in the beginning of September and is continuing to do so. But one thing that is really helpful is for us to kind of know what happened. You know, I know many people are having conversations with Nicole and with me and with Bethany, but if we can have it all in one place, what kind of outreach happened, who you talked to, what activities took place. We have a little August recess reporting form. We're asking people to fill it out by September 30th. I promise it won't take longer than 6 or 7 minutes. Just let us know what you did. And then if you can't see the PowerPoint, it says there's a little picture of my baby smiling. And this is what happens when people do report, and then a sad face of his when people don't report. So hopefully that is a good incentive. And I will stop there and answer any questions.
So I don't see any questions. Well, Tanya just asked for links, which we can do, but I encourage folks if you have any questions, to type it into the Q&A box. I think right now in the chat, we're just getting a lot of Cameron love, which as is deserved.
This was my favorite slide of the entire presentation.
Or we just explained it all so well. Bethany, Claire, and I are all big believers in not making things longer than they need to be. So if folks don't have any questions, that's a-okay too. I'll talk for a couple more seconds because a few things happened while we were on the Zoom. Unfortunately, the HCBS component of the Energy and Commerce Bill did not make it through committee. If you are from New York or Oregon or California, Representatives Rice, Peters, and Schrader voted no. Those are Democrats who voted no to get the bill out of committee. So we would encourage folks to share any frustration with those offices. That being said, that's not an end to the HCBS funding. There's a variety of different reasons it can come through rules. A lot of these pieces, and obviously anything that we're spending money on has to be paid for. And the controversy right now is around the pay for, which is around drug pricing and that sort of thing. We didn't want to get into that here, but all things considered, I just want to say that to assuage any concerns that there might be, that just because it didn't get out of committee, it's just important that we know what is happening as it's happening. The fact sheets, the state level fact sheets are in the Dropbox on our website. I can find that and put it into the chat.
I will just add, the controversy over the drug pricing has nothing to do with HCBS. There is incredibly strong support for HCBS, but because the members wouldn't vote to move it forward, that is why this is all playing out the way it is.
Thank you, Stanford. That would be great. Constituents matter. No offense to either Bethany or I, but it matters a lot more that they're hearing from you than they will certainly be hearing from us too, but it's much more important. Thank you, Claire, for putting the links in the chat. At this point, it's a little after over 30 minutes. I know another question was around the PowerPoint slides for this presentation. Everyone who registered will be sent a copy of the recording as well as the slides. We will continue to keep folks in our chapter network up to date via the listservs. Sorry, I'm with my grandparents and her phone was just going off. And really appreciate everyone's advocacy. Those 3,000 calls in one day, it's huge. That's why it's one example of why the presence and strength of the ARC has really grown since 2017, not only because we obviously had Claire, which is huge and amazing, but everyone using our systems and making sure that those are going up, it really has an impact. And the ARC's name is definitely recognized with some power. And so keep doing what you're doing. We'll keep doing what we're doing. We are on the precipice of some major, once in a lifetime investments in a lot of different areas and chipping away at other problems. And so we really appreciate every single effort that has been taken. We wouldn't be where we are right now if it wasn't for that. So thank you all, and hopefully everyone has a good rest of your Wednesday. And we hope to see everyone in person at some point, maybe DPS next year. Thanks, everybody. Have a good one.